Good afternoon. This is Jessica Stone, Community Relations Director at Mitchell County Hospital District, and I'm here today with Dr. Dee Roach and Jennifer Hale to give you the latest COVID-19 update.
Thank you, Jessica. We just wanted to come on Facebook today and our social media and just stay in contact with our community. We want you to know we're working hard here at Mitchell County Hospital, and we have some things we want to share with y'all and update you on. One thing, I know people have voiced or expressed some concern that we have not seen the positive case show up on some of these reporting sites that you're seeing, that you're able to access, like the Texas Department of Health. And I checked right before we came in here just a few minutes ago, and our case is now showing on the site. It was nothing on our end. We reported it to the Texas Department of Health, and they reported it to the State Department of Health. So it just took a little bit for it to get there. So we're reporting everything that we need to, and that case is now showing up. The other thing I wanted to talk with everyone about is the CDC is now recommending you wear some kind of facial covering if you go out in public places like grocery stores or the gas stations, different things like that. Not so much as to prevent you from getting something, but from preventing others to passing things along to others. There's different recommendations from the CDC on ways that you can do this, because not everybody has a sewing machine at home or materials to make that. Some other ways they recommend making a covering is with a t-shirt or with a bandana. So you can try some of those ways to create a facial covering. You can go to cdc.gov/coronavirus, and they have some great pictures and step-by-step instructions on how you can create something to make you feel more comfortable going out in public places. The other thing that I want to touch on is, of course, our hotline, our COVID hotline number is 728-3431, extension 7070. If nobody answers, then please leave a message, and it will be, we will get back to you as soon as we can. The hotline is open Monday through Friday, 8 to 5. If it is an emergency, please call 911 and report that emergency. This is not an emergency hotline, okay? This hotline is designed for any questions, or if there's any concerns about COVID specifically, or if you are concerned, do I need to see my healthcare provider? What do I need to do at this point? I'm having these symptoms. A nurse will be on the other end of that line to talk with you, and if needed, they will talk with the provider and get back with you about those concerns and questions. I know we all use Facebook and social media as a way to communicate and get some questions across to whoever we can reach out to. Some questions are being fielded to the Mitchell County Hospital inbox, and I would recommend using the hotline instead of the inbox, so that you can talk to a nurse or a medical professional, as that is not the appropriate means to ask those type of questions, any health questions. So please use that hotline instead of the Mitchell County Hospital inbox for any medical questions. I would also just like to reiterate, if you're going out in public, that you're limiting those trips in public, that you're washing your hands frequently for 20 seconds with soap and water, or using an alternative method such as hand sanitizer, and using enough to cover your hands and letting them air dry. Cover your mouth if you cough or sneeze. Cough into your elbow or sneeze into your elbow. Just those basic things that those good hygiene measures that we all need to follow to help prevent the spread. I know that a lot of people have been wearing gloves out in public. There is a thing that's called cross-contamination that can occur if you utilize them in the wrong way. So if you decide to wear a pair of latex gloves or some other glove out in public and you feel like that'll protect you, just realize the things that you're touching may have something on them, and then you just taking your gloves and then you touch your phone or you touch your purse or you touch your keys, and you're touching other things with those gloves, and they're now contaminated with whatever you were touching, like the grocery handle or the different items or things like that, or money. So please just make sure that you're washing your hands. That's the best way to prevent the spread of infection. And I think that's really all I wanted to share with everyone today. I'll turn it over to you, Dr.
Super. So to start with, we'll just go over some of the most recent statistics, and this is about a couple of hours ago. Globally, the number of confirmed cases is now approximately 1.4 million people in the world, approximately 80,000 deaths globally. In the United States, confirmed cases are now in excess of 380,000, with approximately 12,000 deaths. In Texas, we're now over 7,000 confirmed cases with 140 deaths. According to most experts who are analyzing the data that we're getting right now, most accurate models would predict that our peak season or peak occurrence for this disease is going to be probably over the next 2 to 3 weeks. So we're looking into the first part of May most likely before we actually start seeing some of the decline of occurrence here locally. As most of you know, effective midnight Friday night, the county judge has placed a limited stay or shelter in place order for our county. It's extremely important right now that we comply with these orders. Although we may not see a high frequency of occurrence here locally, we need to understand that people who are asymptomatic or even mildly symptomatic can still be actively infectious. And so because of that, it makes it even more important for us now to comply and be responsible with maintaining our social distancing and complying with the shelter-in-place order. What to do if you have symptoms? A lot of people are going to have symptoms this time of year. It's our allergy season, and so a lot of people are going to have runny noses and sneezes and coughs, which may or may not be associated with some fever. If you do have symptoms suggestive of coronavirus, which includes fever of 101 or greater, persistent cough, worsening shortness of breath, and really the travel issue is really not an issue anymore. This thing has now become ubiquitous and universal in its occurrence. But if you do have those symptoms, I know you're anxious to know if you have coronavirus or not, but the best thing for you to do is go home and self-quarantine for 7 to 14 days, depending on the circumstances. We do have capability of testing here, but we are extremely limited with the number of testing transport media that we actually have, and so we have to reserve those for the more severe cases. And so I know everybody wants to know if they have it or not, but right now we just don't have that capability to test everybody. Questions have been raised about blood tests for coronavirus, and certainly at some point in time those will be the standard by which we determine if you do have coronavirus or did have coronavirus. But right now those testing procedures are still in evolution and development right now and are only available in certain urban areas. So right now that's not a viable option, for at least not for us right here. Reiterate what Jennifer said. Right now it's critically important to employ those techniques that we've heard all about. Make sure you wash your hands, make sure you maintain your social distancing, try to limit your exposure, and try to limit the exposure that you have to other people as well. This is a bidirectional transmission. You can get it or you can give it just as easily. So please comply with those limitations that we've requested through the current shelter-in-place order. And if you have questions, Jennifer's outlined the best way to get those questions answered for you. Again, stay safe, be healthy, make sure you eat well, stay hydrated, and try to limit your exposure.